This illustrates the microscopic behavior of a highly specialized hybrid, the neuroendocrine cell. These cells possess a dual nature. They receive nervous system stimulation, like a standard nerve cell, but respond by manufacturing and secreting chemical droplets, hormones, directly into the bloodstream, acting like an endocrine gland. Because of this dual function, neuroendocrine cells are not confined to a single organ. They are distributed extensively throughout the human body, highly concentrated in the gastrointestinal tract, the pancreas, and the lungs. In a healthy system, these cells operate as biological messengers. They release precise amounts of serotonin, insulin, or gastric acid to coordinate vital everyday functions, like digestion, metabolism, and our physiological response to stress. The pathology begins when these specific cells mutate. They begin to divide and proliferate uncontrollably, forming a neuroendocrine tumor, or NET. When this happens, they stop acting as careful messengers and instead become rogue endocrine factories, flooding the body with excess hormones. This split-screen diagram highlights a central problem in treating this disease. To understand the full scope of a neuroendocrine tumor, we will analyze it through two distinct clinical lenses, the seed and the soil. On the left, Western medicine analyzes the seed, the structural biology, the specific cellular mutations, and the chemical outputs of the tumor. On the right, traditional Chinese medicine, or TCM, evaluates the soil, the systemic, energetic environment, and the prolonged physiological stagnation that precedes the growth. Because a NET involves both physical structures and systemic chemical communication, mapping the pathology requires investigating how these two frameworks intersect. To see the structural damage these tumors cause, we start in the gastrointestinal tract and the pancreas. These organs are the primary staging grounds for the majority of neuroendocrine mutations. This schematic cross-section details what Western medicine classifies as a functional neuroendocrine tumor. These tumors actively manufacture and release massive quantities of active hormones directly into the flowing bloodstream. The symptoms a patient experiences depend entirely on which hormone the tumor produces. An insulinoma, for example, secretes excess insulin, which drains glucose from the blood and triggers hypoglycemia, trembling, and sudden confusion. A gastrinoma produces massive volumes of gastrin. This signals the stomach to produce excessive acidity, leading to burning pain and recurrent chronic ulcers. In a VIPoma, overproduction of vasoactive intestinal peptide forces the intestines to secrete water, resulting in profuse diarrhea and rapid electrolyte imbalance. Not all NETs actively secrete hormones. Non-functional NETs remain chenically silent, meaning they do not trigger these early warning signs. They are often diagnosed much later, after the mass grows large enough to cause mechanical pressure and physical obstruction in the abdomen. A NET is a deceptive structural disease. The clinical presentation is the product of the specific chemical language the rogue cells speak. When functional neuroendocrine disruption reaches its peak, it presents as carcinoid syndrome. This physiological map illustrates the exact biological trigger. Serotonin-producing tumors in the GI tract release their hormones into circulation. Normally, the liver breaks down this excess serotonin, but when the tumor metastasizes to the liver itself, that safeguard fails. The serotonin entirely bypasses filtration and floods the upper systemic circulatory system. The immediate physical consequences of this unchecked serotonin flood manifest in the gut and the lungs, causing acute, severe diarrhea and intense respiratory wheezing. The cardiovascular system absorbs heavy damage as well. The constant hormone spikes cause severe facial flushing and rapid heartbeat, eventually leading to the physical degradation and scarring of the heart valves over time. This chemical saturation also reaches the nervous system. Clinicians track specific diagnostic markers in the blood, like chromogranin A, measure 5-HIAL levels in urine to catch serotonin excess, and utilize advanced octreotide imaging to locate the precise coordinates of the tumor. Once located, a biopsy determines the tumor's grade. By measuring exactly how rapidly the malignant cells are dividing, oncologists can establish the aggressiveness of the disease and map the overall prognosis. The primary structural intervention is surgical removal. For localized disease, extracting the tumor physically cures the condition and instantly halts the life-threatening volume of hormones entering the bloodstream. When surgery isn't possible, molecular interventions take over. In this microscopic view, we can see somatostatin analogs, like octreotide, at work. These pharmaceutical blocker molecules attach precisely to the cell wall, capping the receptors and forcefully neutralizing the tumor's ability to release its internal hormones. For intermediate and highly aggressive mutations, Western medicine escalates to targeted therapies. This includes chemotherapy for poorly differentiated cells or peptide receptor radionuclide therapy, a specialized treatment where the tumor cells absorb radioactive peptides that destroy them from the inside out. Western oncology excels in this domain. It provides the highly precise, targeted weaponry necessary to halt rogue cellular division and neutralize immediate fatal chemical threats. But neutralizing the tumor does not explain why the tumor formed. For that, we pivot to the traditional Chinese medicine framework, moving our focus from the isolated mutant cell to the broader terrain of the human ecosystem. TCM defines a neuroendocrine tumor as a state of profound constitutional and energetic disorganization, rather than an isolated, localized invader. To measure this disorganization, TCM relies on different clinical data. Practitioners observe the color of the facial complexion, the coating on the tongue, and use traditional pulse diagnosis, feeling for a wiry, slippery, or rapid pulse to indicate specific internal blockages. This comparative table translates the exact same clinical symptoms into two different languages. While Western medicine sees facial flushing as a hormone spike, TCM diagnoses it as internal heat or rising yang. Chronic diarrhea is interpreted as spleen deficiency with damp accumulation, and the physical tumor mass itself is seen as a combination of condensed phlegm and blood stasis. Even the psychological symptoms align. The severe anxiety and brain fog caused by serotonin overload map directly to the TCM concept of Shen disturbance, indicating an imbalance in the heart and pericardium networks. In this framework, the physical tumor is the final, visible symptom of an internal regulatory network. TCM tracks a progressive 5-step pathogenesis, a timeline that begins long before any physical mass appears on an MRI. It starts with step 1, constitutional imbalance. Chronic psychological stress, suppressed fear, and poor dietary habits severely injure the energetic function of the liver and the spleen. This flowchart illustrates the descent into pathology. Step 2 is qi stagnation. As the liver's ability to move energy is impaired, the smooth flow of qi becomes obstructed. The pathways become knotted, generating intense internal pressure and the initial stages of hormonal dysregulation. This pressure forces step 3, phlegm formation. Because the weakened spleen can no longer efficiently transform fluids, those fluids accumulate and thicken. In TCM terminology, phlegm refers to pathological materializations like cysts, precancerous nodules, and thickened tissue. Left unresolved, this leads to step 4, blood stasis. The long-standing energetic stagnation and fluid accumulation eventually solidify. The energy hardens into palpable tumor masses, generating the fixed stabbing pain common in metastatic spread. The final stage is step 5, toxic heat. This represents the most advanced aggressive phase of the disease, marked by severe internal inflammation, fever, and rapid tissue destruction. This 5-step evolution suggests that chronic emotional and systemic stress physically crystallizes into malignant structures over time. In clinical practice, the boundary of integrative medicine must be strictly defined. TCM does not claim to instantly remove established tumors, nor does it act as a standalone cure for neuroendocrine cancer. This dual-action matrix illustrates an integrative approach, targeting the seed and soil simultaneously. While oncology physically attacks the central mass, TCM protocols support resilience. Specific herbs move qi, resolve accumulated phlegm, and invigorate blood flow, actively reducing stasis and hardness around the tumor site. Acupuncture plays a highly specific role in this process. Clinically, it improves the patient's collapsed digestion, regulates the autonomic nervous system, and actively reduces the neuroendocrine stress response that fuels the disease. The two models divide the labor. Western medicine wields advanced molecular treatments to halt cellular pathology and extend survival. TCM applies energetic therapies to drastically improve fatigue, restore appetite, and ensure the patient's body can actually tolerate the harsh oncological treatments. This integration clarifies a critical reality. Foundational lifestyle interventions, strict dietary management, and serious emotional regulation are clinical necessities required to alter the internal energetic terrain that allowed the tumor to grow. Treating a highly complex, multisystemic illness demands a model that respects that complexity. It requires a system that successfully eradicates the structural biology of the disease while relentlessly restoring the energetic ecology of the patient.